Dr. Shore's role is really directing the care of all of our patients. He is called with every admission, and then he works with the team in directing the end-of-life care that is provided by the nurses and the whole team, the IDG team.
He oversees the care of every patient that we care for. And he oversees that care in all aspects of the patient's care. The clinical, also psychosocial, also spiritual.
He's always teaching new nurses how to do the pain and symptom management. It's not rocket science, but it does take some knowledge base, and when things aren't working, step A isn't working, we go to step B, and he always has an answer for us.
He's taught our staff and physicians in the hospital and residents and staff nurses in the hospitals and patients and families the importance of identifying your goals, the goals of care that are important to you at this point in your life, and that it's important to talk about those goals of care with our patients and families so that they can guide us in determining what's the most appropriate care for them.
Dr. Shore's passion is really the care of our hospice patients. He would like everyone to have a peaceful death. He would like our staff to have the knowledge to make them comfortable at the end of life. And he would like to celebrate each of our patients' lives. As a field nurse, I've been on many visits with Dr. Shore to families. And I can tell you, if I go into a home where a patient and family are very anxious and Dr. Shore shows up, he is able to make that family feel at ease.
I've worked with Dr. Shore since I came on staff in 2006, and he is the best medical director that I've ever worked with. Like I said, I've worked with 4 hospices in my career, and Dr. Shore's compassion and love for patient care really inspires me every day. And just to sit with him and team each week and to see the compassion and the passion in which he brings to end-of-life care is very inspiring.
He's very bright, but we really hate to tell him that too often. He's energetic. He's a little guy who moves really fast, and he thinks really fast, and he triple tasks in the work that he does. But never, ever do you feel like you've been not noticed or not listened to. He's always there to support the staff. Every patient and family that he's visited has had such wonderful comments to say about the care and the passion that he's showed towards their situation.
Dr. Shore's passion is to see that every single patient really achieves their goals of care. Dr. Shore really is a pioneer in the concept of goals of care. He has taught us all what that truly means. Long before it really became a catchy phrase that's used a lot in hospice now, Dr. Shore had already figured it out and implemented it with us. One of the first things that he says to us when we admit a patient is, what are the goals of care for this patient? Because everything that we do for this patient and family revolves around those goals of care, and they are absolutely #1 important thing to start with in order to give the best care that we can to these patients.
I can remember a Bosnian patient that I had who, there's some cultural differences about death and dying with lots of different cultures, but this family had some, ideas that, was from their faith and their culture. Dr. Shore, before he talked about anything about pain and symptom management, he really sat down with the family, and he knew, he's so smart, he knows about world events, He knows about the war in Bosnia. He talked with his family. Well, he sold them right then.
One of the first home visits he made was in, I think it was the Sullivan area, and there was a terrible snowstorm and ice storm, and so he went to a rural farm home, and he was going to go into the home and make the visit, and he got out of his car, and it was so icy that he literally slid to the front door and hit the front door with his body, and they opened the door and he said, I am Dr. Shore.
He visits patients every week, and he's very involved in the hospice. He is on call 24/7, and if a need arises, the nurses call him for direction and providing that care.
He is absolutely an awesome medical director, because I have worked with others, and I just can't say enough good things about him. He is compassionate and calm, and he is smart and has a wonderful sense of humor, which keeps us all sane.
He has a new definition, I think, to 24/7. I think that probably there's been one time that he actually had someone cover for him when he was away. But beyond that, he's always available, if it's a mountaintop, or if it's a wedding, or if it's a concert, or if it's a workshop that he's at. He's always available.
He had surgery, and they took his phone away. He did, however, manage in the recovery room to find a phone and call me to see what was going on. However, he was a bit fuzzy on that call.
Dr. Shore is a chocolate lover. Everybody knows this about him, so we have different bowls of chocolate around the office, so he knows he can go to anyone's desk and find some chocolate. When we moved to our new building, he was given a desk, and there was a bowl of chocolate there for him, and I know that the staff always likes to try to keep it full for him. So if you needed anything from Dr. Shore and you felt like you needed a little help in getting what you want, chocolate always helps.
Loves chocolate. Last week when we honored him and made him King of the Day, he received a 5-pound chocolate bar. And when we always make sure that we have chocolate in the office. And I always try to make sure that I throw a little chocolate his way every Wednesday morning before team.
You know, anyone who has chocolate out, he always makes sure he stops by your desk because he wants to have some chocolate. So when we told him that he had this award, Lifetime Achievement Award from MHPCA, one of the gifts that he received was 5 pounds of chocolate. And it was a #1, and it said on it, #1 doc. And you know what? He didn't even offer to share it with us because he loves it so much he wanted to take it home and eat it all for himself. So he does love chocolate.
He is a chocolate fanatic. In fact, I learned very early on, in order to keep Dr. Shore's mood as I would like it to be, I have his favorite chocolates by my desk.
I am so proud to be affiliated with BJC Hospice, and especially with Dr. Shore, because he has been such a great mentor to not only me, but the other clinicians at BJC Hospice. He's taught us about end-of-life care. He's taught us about pain and symptom management, and that has led to many, many peaceful deaths for our patients, which is our goals of care.
I really, truly appreciate his commitment, his dedication to end-of-life care, and his passion in making sure that the patient and family receives the best quality care and that their wishes are lived out every day in a meaningful way.
We believe that Dr. Shore is worthy of this award because he is truly, truly dedicated to our hospice and every single patient we've ever cared for. We all wish that we could be with you today, Dr. Shore. Please know how proud we are of you and grateful that we have you with us.
Bernie, and I appreciate the opportunity to call you Bernie, Dr. Shore. I just want to tell you that working with you has been an honor for me, and something that I will always cherish in my career. And I thank you for all of what you've contributed to our staff and to our patients and families, because you truly, truly have made a difference. Thank you.